Welcome to Healthcare Authority's Alien Emergency Medical Eligibility Training. Throughout our training today, we will refer to the Alien Emergency Medical Program as AEM. This training is designed for community partners who assist individuals with applying for and submitting medical documentation for the Apple Health AEM program. We will be providing instruction on the AEM application process for both DSHS and HCA. I would like to remind you that today's presentation will be recorded. Both the recording of the webinar and the presentation slides will be added to the Training and Education webpage, which we will share with you at the end of our webinar. These are the topics we will be reviewing during this presentation. The next few slides will provide an overview of AEM and outline any updates. AEM is a program for individuals who do not meet citizenship or immigration status requirements, or for qualified individuals who have not met the 5-year bar and who have a qualifying medical emergency that is covered under the AEM program. Individuals applying for coverage due to a pregnancy-related hospitalization should apply for Apple Health for Pregnant Women coverage and not for the AEM program. We want to stress that it is safe for anyone to apply for healthcare coverage. Immigration information is not shared under any circumstances with Immigration and Customs Enforcement. HCA is now encouraging individuals to apply online through the Washington Health Plan Finder for MAGI-based AEM. This is a change in process. However, due to system upgrades, it is now much more efficient to apply online. HCA has created a fax cover sheet to be used when submitting the supporting medical documents for MAGI-based AEM. Both Healthcare Authority and DSHS receive and process AEM applications. The Healthcare Authority processes AEM applications under MAGI Medicaid, which includes Apple Health for adults, children, family, and pregnancy coverage. For the Apple Health for Adults program, the individual must be age 19 up to age 64, not receiving Medicare, and follow MAGI rules established through the Washington Health Plan Finder. DSHS processes AEM applications under Classic Medicaid when an individual is age 65 or older and is not a caretaker for a child under age 19, or the individual is receiving long-term care services and is not relatable to a MAGI program, or when the individual is receiving Medicare, which is not common for this population. The next few slides will provide detail on what constitutes a medical emergency. To qualify for AEM, an individual must have or need at least one of the following: a qualifying emergent medical condition, such as emergency room care, inpatient hospital admission, or outpatient hospital surgery, a cancer treatment plan, dialysis treatment, anti-rejection medication for an organ transplant, or long-term care services. Long-term care is a program with limited availability and must receive prior approval by the ALTSA program manager. In order to be eligible for AEM, an individual must have incurred an emergency medical condition as described on this slide. HCA clinical staff will determine whether or not the condition meets the criteria of an emergency medical condition. The next few slides will outline the application process for MAGI-based AEM applications. The Healthcare Authority is encouraging individuals applying for MAGI-based AEM to apply online through the Health Plan Finder. A paper application is available if the applicant is unable to complete the application online. Please follow your lead organization's established procedures for ID proofing. The application for healthcare coverage can be found at the link shown on this screen. Here are some tips to avoid duplicating IDs in the system, including a Provider 1 ID number. Please follow your established procedures for ID proofing and matching. Follow your lead organization's established procedures for partnering to an application. If you receive an error code, follow your troubleshooting guide for resolution. If an applicant was hospitalized or treated in a hospital emergency room, has cancer, or needs dialysis, it is critical that the applicant marks yes to this question when they are applying for MAGI-based AEM. When submitting an application for multiple dates of service under MAGI-based AEM, list all of the dates of service on the fax cover sheet and include the supporting medical documents for each date of service. If an AEM application is pending and the person incurs another emergency medical condition, do not submit another application. Instead, complete a new fax cover sheet and write the original application ID in the appropriate field. Write the new dates of service in the field provided and include the supporting medical documents for the new emergency medical condition. Fax all documents to 1-866-841-2267. This is a screenshot of a successfully submitted application under MAGI-based AEM. If an AEM application is denied due to income exceeding the MAGI-based income standard and the applicant hasn't indicated they are disabled, refer them to Washington Connection so their application can be evaluated for the AEM Spend Down program through Classic Medicaid. We ask that you check the Washington Health Plan Finder and Provider One before you request an AEM status update. To obtain a status update or ask questions about a MAGI-related AEM case, please call the Healthcare Authority Medical Assistant Customer Service Center at 1-800-562-3022. Emergent requests will be directed to the Medical Assistance Customer Service Center to the AEM team for follow-up with the client or authorized representative. The next few slides will outline how to apply for AEM under Classic Medicaid. The application process for Classic Medicaid has not changed. To submit a Classic Medicaid application online for AEM, the following steps are required. First, submit the AEM application at Washington Connection. Next, fax all supporting medical documents for Classic Medicaid to 1-888-338-7410. We will discuss the required supporting medical documents at length later in this presentation. I want to call out that long-term care applications are processed by the Aging and Long-Term Support Administration, better known as ALTA. To submit a paper application for AEM for Classic Medicaid, the following steps are required. Write AEM on top of the application. Write the dates of service on the application. Include applicable supporting medical documents, which we will discuss at length in the next section, and fax the completed paper application and supporting medical documents to 1-888-338-7410. We ask that you check Provider One before you request an AEM status update. To obtain a status update or ask questions about a Classic AEM Medicaid case, call DSHS Customer Service Contact Center at 1-877-501-2233. Emergent requests will be directed by the Customer Service Contact Center to the AEM team for follow-up with the client or authorized representative. If an AEM application is in pending status and the person incurs another emergency medical condition, do not submit another application. Instead, fax the supporting medical documents for the new medical emergency medical condition to 1-888-338-7410. Be sure to write the ACE's client ID on the fax cover sheet and include all supporting medical documents. The next few slides will provide information on the required supporting medical documents. To determine clinical eligibility for AEM, supporting medical documents are required. It will expedite the process if supporting medical documents are submitted at the time of application. The next two slides provide a description of the required supporting medical documents based on each particular emergent condition required to determine clinical eligibility for AEM coverage. If the individual received emergency room care, the following medical documents must be provided: the emergency room treatment pages and a copy of the completed hospital claim form, better known as the UBO-4. If the individual received outpatient surgery care, the following medical documents must be provided: the operative notes and a copy of the UBO-4. If the individual was admitted and received inpatient care, the following medical documents must be provided: the history and physical, the hospital discharge summary, and a copy of the UBO-4. If the individual is in need of cancer treatment, the following medical documents must be provided: the current cancer treatment plan from the attending physician and the pathology report if available. If the individual is in need of dialysis treatment, the following medical documents must be provided: the current dialysis flow charts from the dialysis center or the treatment plan from the attending physician. If the individual is in need of anti-rejection medication for a post-organ transplant, the following medical documents must be provided: the treatment plan from the attending physician or provider, including the required medications. HCA has created a fax cover sheet for submitting the supporting medical documents. HCA is requesting that this fax cover sheet be used when faxing the supporting medical documents associated with the MAGI-based AEM online or paper application. Medical documents should never be uploaded into the Washington Health Plan Finder. The application process for Classic AEM has not changed. Fax all supporting medical documents for Classic Medicaid to 1-888-338-7410. If the applicant is submitting a paper application, include the supporting medical documents in the original application. The next few slides will outline the HCA clinical referral process and final steps to the application process. Once the application and required documents are received, they will be sent to the HCA clinical consultant for a decision as to whether or not the condition meets the criteria for the AEM program. If the additional clinical information is needed to make a decision, the referral coordinator or provider's office will be contacted via phone, and a letter will be sent via fax requesting the clinical documentation. If the required documents are not received within 10 days, the application will be denied. It can take up to 15 days for the HCA clinical consultant to make a decision. Once the HCA clinical consultant makes a decision, the HCA medical assistant specialist or the DSHS financial services specialist will approve or deny the AEM application according to the clinical consultant's decision. Approval and denial notices for MAGI-based AEM and Classic AEM are mailed out of the Health Plan Finder or ACES respectively. Eligibility will be considered if the individual provides any missing verification within 30 days of the date of denial. This is a screenshot of what an ongoing MAGI-based AEM approval looks like in the Health Plan Finder. This is a screenshot of what an AEM decision looks like when the applicant is not eligible for ongoing coverage. There won't be anything about the AEM decision in the household coverage summary. In order to see if the application was approved or denied, you will need to look in the Message Center for the updated eligibility decision and the important information letter. These letters will explain the eligibility decision. If the applicant is eligible for a qualified health or dental plan, this information will display under your household coverage summary. The next slide concludes our presentation. We'd like to end our presentation today by leaving you with some additional Apple Health resources, including Apple Health Medicaid. This page shares how to apply for Apple Health, renew coverage, and select an Apple Health Managed Care Plan in the Health Plan Finder. Training and education. This page provides our HCA community partners with helpful enrollment guides, training, webinars, and outreach materials. Today's recorded AEM presentation and presentation slides will be added to the Training and Education webpage under Webinars, Videos, and Media Presentations. You will find listed on this screen the links to both the HCA area representatives and a cross-agency customer service center referrals desk aid. Finally, general questions regarding the Apple Health application and renewal process can be directed to Medicaid expansion at hca.wa.gov. This concludes our presentation. Thank you.